Hello, my name is Elena. By training, I am a molecular geneticist specializing in hereditary diseases. In August 2022, I was diagnosed with breast cancer. It was at the first stage, with no lymph node involvement. Therefore, the first step was surgery. After histological examination, the type of tumor became clear. It was of moderate aggressiveness, luminal type B. According to all international protocols, further adjuvant therapy should have included chemotherapy, radiotherapy, and only after all that, long-term antihormonal therapy. Having a history of myocarditis and hepatitis A, I seriously considered whether it was appropriate to undergo the adjuvant chemotherapy stage, taking into account all the benefit risk factors for my health. Why? Adjuvant therapy is an additional treatment that is prescribed after the main treatment, such as surgery, chemotherapy, or radiotherapy, in order to prevent recurrence or metastasis of the disease. The aim of adjuvant therapy is to destroy any single cancer cells that may have remained in the body after the main treatment. So, I understood that this was chemotherapy just in case, and I had a wild resistance to it. And at that moment, there was a meeting where my friends, having learned about my problems and doubts, suggested that I undergo a course of NK cell therapy. I looked into the matter and realized that if my immune system had missed typical cells, then the most natural thing would be a course of replacement immunotherapy, specifically with NK cells from a healthy donor. That's exactly what I did. I refused the course of chemotherapy and underwent the necessary examinations. And I completed the recommended course of NK cell therapy from the company Global Age Management Alliance. From my own experience, I became convinced that biotechnology and regenerative medicine are a new level compared to outdated methods, such as adjuvant chemotherapy for stage 1 hormone-dependent breast cancer. Of course, I want to add that every case is unique, and it is essential to approach each patient and their illness very carefully and thoroughly. It is now the year 2025. In August, it will be 3 years since the diagnosis and the start of treatment. I am in remission. This is quite a significant period to understand that we managed to overcome it back then. I am grateful to my friends, NK cells and, of course, the Global Age Management Alliance.